Good morning, dear students. Today we will discuss the post-endodontic treatment, like reconstruction of teeth with endodontic treatment. So if we look at this picture, we can see, or we can suggest that tooth, this is something like a house. It means that it could have the perfect floor, and first of all it could have a perfect roof. Just in this case it will be like survival. So you know that endodontic treatment, this is a some important part of the dental treatment, and during this we should to shape the root canal system, and because we provided this shaping using the mechanical shaping, using the disinfections, it's therefore accepted that teeth with endodontic treatment are weaker and tend to have a lower lifetime prognosis. But it's necessary to keep in mind that perfect endodontic treatment with bad post-endodontic reconstruction has a really low prognosis for survival. And so this successfulness of the endodontic treatment, or of these teeth with endodontic treatment, depends not only on the quality of the root canal treatment but also on the coronal reconstruction of the teeth. If we look at the history, we can see that different methods of endodontically treated teeth restoration have been reported for past 200 years. And for example, in the 18th century, appear Fouchard fabricated gold and silver posts to be placed in root canal system. Replacement crowns were made from different materials like bone, ivory, animal tools. So we can see that this issue is really historic and old. There is a logic question: is final restoration after endodontic treatment important? If we look at the literature review, we can see these numbers. Good restorations and good endodontic treatment resulted in absence of periapical inflammation in more than 90% cases. Poor restoration and poor endodontic treatment resulted in the absence of this periapical inflammation in only 18%. And poor endodontic treatment and good restoration yielded a success rate of almost 68% of the cases. So it showed that the final reconstruction is really important, and it could be as perfect as is possible. What are the main aims of this final restoration? First of all, we should to provide the maintenance, coronal and apical seal of root canal treatment. We should to save and protect the remaining parts of hard dental tissues. We should provide a supportive and retention foundation for the placement of definitive restoration, and we should restore the function and aesthetics. So, which factors should be kept in mind when we plan this final restoration? First of all, this is the amount of remaining intact tooth structure. This is the occlusal function, opposing teeth, position of the tooth in the arc, as well as length, width, and curvature of the roots. And based on the remaining tooth structure, Ingrid Perros deferred all of these teeth with endodontic treatment according to the remaining tooth structure onto 5 classes, where class 1 means that the tooth has 4 remaining walls, class 2 3 walls, class 3 2 walls, class 4 just 1 wall is remaining after endodontic treatment and after the this reconstruction, and class 5 means that there are no walls on these tooth. Here we can see these different defects on the pictures, class 1 up to 3, where we have 2 up to 4 cavity walls remaining, so it creates the most safe conditions for the consequent post-endodontic reconstruction. In this case, there is no usual use of post. With respect to core, it will be made using adhesive technique, and with respect to definitive restoration could be used any definitive restoration, including direct and indirect technique. Class 4, in this case we have just 1 cavity wall remaining, and here you can see that the larger defect of hard dental tissues, where it's necessary to put the post, could be fiber, sometimes metal, core could be adhesive, or in the case of metal, post cast, and definitive restoration should be mostly crown, like in this case of premolar, or onlay or crown. And class 5, where we don't have any walls on the tooth, it's necessary to put the post, that could be fiber or metal, core could be adhesive or cast, and definitive restoration in this case will be the crown. It will be also depend which type of core or post depends on the thickness of the remaining dentin. With respect to post-endodontic reconstruction of anterior teeth, if you have really minimal loss of tooth structure, that is barrier just the excess cavity, in this case is really easily to provide this post-endodontic treatment. It means that we will make the direct composite reconstruction. A post is of little or no benefit and could increase the chances of a failure. So we just put, if we have just this excess cavity, we don't use the post in these teeth. But if we have extensive loss of external tooth structure, we usually use a post. Due to the predominantly shearing forces present at the narrow tooth dimensions. And extracoronal crown preparation combined with endodontic access preparation significantly weaken the cervical area of anterior teeth. So if we have larger extensive loss of external tooth part, we should to put the post in this tooth, like for example we can see here. This is the external loss, and so crown and use of post is necessary. With respect to posterior teeth, it's like more complicated case because they have their position is closer to the insertion of the masticatory muscles, and also they have a higher mastication load, so they are more susceptible to fracture. Here we can see some case report of post-endodontic treatment of the posterior teeth, and with respect to opinions of authors, you can find really different opinions, and mostly or generally, and we use the same principle on our clinic, that all of the premolars with endodontic treatment should be covered by crown. With respect to molars, if we have just mesial-occlusal cavity, it could be done using, for example, some onlay, inlay, but if this is a larger defect, it's better to make the crown, but also depends on the many factors. Here, for example, the fiber post was put, then adhesive core was made, and finally the crown was realized. Here we can see some another case of endodontic treatment in posterior teeth of the molar, where we can see a relatively large defect of the molar, but note that the three walls are maintained, and finally indirect onlay was placed on this tooth. But also note another case, and it could be unfortunately relatively frequently, like tooth fracture of endodontically treated maxillary molar restored with bonded composite restoration without post and without crown. So in this teeth in posterior is not so useful like direct reconstructions. What about components of final restoration in the teeth? These are the post, these are the cores, and these are the crowns. Post, their primary purpose, this is a retain a core that could be used to support the final restoration, and note that post don't reinforce teeth with endodontic treatment, and post is not necessary in the cases when substantial tooth structure is present after the preparation of the tooth. In which cases we will use the posts. Posts could be placed if both of the following clinical conditions exist. If we have the remaining coronal tooth structure is inadequate for the retention of restoration, and the second condition is when there is sufficient root length to accommodate the post while maintaining an adequate apical seal. Factors that should be kept to consider: post length, post diameter, and post design. With respect to post length, it could be more than the incisor cervical or occlusal cervical dimension of the crown. The post should be longer than the crown. The post should be 1/3 of the length of the crown, and the post should end halfway between the crestal bone and the root apex. So here we can see ideal preparation of tooth for post placement according to the guidelines. In this ideal situation means that the tooth will have ideal conditions for the further core and crown reconstruction and for the survival. Note that short posts are more likely to lead to the root fracture. With respect to post size and length, this post length is unique and should be individualized for each case, and also it necessary keep in mind the root morphology before the placing a post. The longer the post, the greater the retention means. And so guideline of 1/2 to 3/4 of the root length is often followed, but may not be reasonable for extremely long, short, narrow or curved roots. So once more, each case is individual, and this size and length should be individualized. The effect of the embedded depth of post on retentive capacity has been shown to be significant. Remember this. With respect to diameter of the post is done by the root canal anatomy, and minimal thickness of dentin of root canal wall should be at least 1 millimeter around the post. In this case we have something like safe conditions for post placement. Here we can see different, like for comparison, different diameters of the post here, where in the picture A we have 2 narrow posts. On the picture C we have 2 large, 2 wide post, and at the picture B we have optimum size of the post that has the optimal conditions. With respect to post design, they could be serrated, could be smooth, roughened or threaded. With respect to parallel or serrated posts, they are cemented, fixed into the root canal passively. They are retentive and produce less stress on the root dentin than, for example, threaded systems. Here we can see some like serrated. With respect to ferular effect, this is a really important term with respect to post-endodontic treatment, and generally it means the circumferential ring of intact tooth structure that is enveloped by the cervical portion of the crown restoration. And minimum height of this intact dentin of the ferula should be 1.5 up to 2 millimeters. That is required between the core and between the crown margin. This is a minimal thickness. So here on the picture we can see that this sufficient thickness provides for ferular effect, and so creates these tooth more safe for further reconstruction with respect to a long-term effect of this reconstruction. So it could be ferular, it could be at least 2 millimeters of intact dentin. The ferula provides bracing or casing action to protect the integrity of the root, and if we have this ferula, once more I'll say that this reconstruction will be survive, and also this is a protection of fracture of the root. So, with respect to characteristics of an ideal post, it should require the minimal preparation of root canal wall, it should be resistant to fatigue, it should have the elastic modulus similar to the dentin, it shouldn't be corrosive, it should be retentive, like have post and head, it should be easy to adjust and fit, should be radiopaque, and should be done from adequate material and easy removal if it's necessary. So, with respect to types of post, they could be, with respect to material, metallic and non-metallic. Metallic post could be done from stainless steel, titanium alloy or gold plated brass. With respect to non-metallic posts, they could be carbon fiber, ceramic, glass fiber reinforced or composite. Here we can see different types, metal, this fiberglass, prefabricated poles that can have different design, different shape, different length, or custom-made posts. These posts are made from the wax using direct or indirect technique and to use the wax pattern before the casting. So this is something like impression of root canal of the concrete tooth. With respect to custom cast post and core, they have of course some advantages and disadvantages. Like advantages, this is a preservation of maximum tooth structure, this is a provision of anti-rotational properties, they provide the core retention, they have less chances of vertical fractures during preparation, and they have high strength. But they have less stiff than road. Their making is time consuming, and this is a complicable procedure. Generally they are used in elliptical canals or flared canals. With respect to prefabricated taper post, they conserve tooth structure and have high strength and stiffness, but on the other hand they have low retention and longitudinal splitting of remaining root. So according to these properties, they are recommended to use in small circular canals or very tapered canals. With respect to prefabricated parallel-sided smooth post, they have excellent clinical retention, they have minimal stress production within root, they have superior rating and easy placement. But also they are expensive. With respect to stainless steel, could be corrosive, could have the corrosion, and they are like less conservative for tooth structure, so require the preparation of more hard dental tissues. With respect to prefabricated threaded posts, they have high retention, but they generate the high stress due to their application, and these stresses could lead to fracture of root canal. They don't conserve the coronal and radicular tooth structure. They're recommended to use only when maximum retention is essential, so they're not so widely used. With respect to carbon fiber post, they require the dentin bonding, so they have this bonding with dentin and they're easy removal. With respect to disadvantages, they have low strength compared to metal. They are lack of radiopacity, and carbon color could or presents some aesthetic problem for the future reconstruction. They could be used in posterior teeth with moderate loss of coronal structure. And fiber reinforced post, they are aesthetic, but they have low strength and high failure rate, and they shouldn't be used where remaining tooth structure is less than ideal or where high occlusal forces are present. With respect to zirconia ceramic post, they are aesthetics. They have high stiffness and high elastic modulus, but they are expensive and have uncertain clinical performance. So they are recommended to use where the high aesthetic demands exists necessary. With respect to procedure, in more details you will be informed with this during the next year of your study, but just shortly, step by step. First of all, we should to remove the good aperture from root canal up to required length of the post. For this aim, we can use special burrs that mostly are the part of this post and core system, post and core set. We should provide the preparation, like minimal preparation for the post base. Of course, according to the type of this post. Finally, we should to provide, because nowadays we prefer to use adhesive posts that are placed using the adhesive technique. We should provide the dentin pre-treatment, plus finally place the luting agent, insert this post, and provide them curing according to the type of luting agent, and consequently perform the build up and provide the preparation of this abutment, and finally this tooth is prepared for the future reconstruction, for example for crown fixation. Here we can see the review of different mechanical properties of different materials or different posts from different materials. And we can see from these different studies that the fiber posts are the most reliable according to these different physical and mechanical properties. With respect to cores, in which cases are indicated? Core restorations are indicated if any of the following clinical conditions exist. For example, this is a replacement of missing coronal tooth structure is necessary, or when the enhanced retention and resistance to displacement of the final restoration is necessary. The core could be realized from different materials, like directly using composite resin or dual core composite cement, or indirect method using the casting. With respect to composite resin core, it has good compressive strength, it's easy to make it. It has fast polymerization and bonding with dentin. But with respect to disadvantages, because we have composite resin, it has polymerization shrinkage and poor dimensional stability due to this. So it's recommended for posterior and anterior teeth, just in the case of isolation. So we should to have all of the rules of adhesive techniques. With respect to crown placement, indications is realized when the better aesthetics is necessary, or in situations in which the structural integrity of natural crown is compromised. With respect to contraindications, we don't make the crowns in the case if we have anterior teeth just with excess cavity. With respect to advantages, the crowns are durable, they provide the good aesthetics, they restore the dental function, they have good form and protect the tooth. But with respect to disadvantages, they lead, or preparation for the crown leads to loss of tooth structure, and they are expensive. We can use different types of crowns for the teeth with endodontic treatment. One of them, this is a metal ceramic crown that consists of a ceramic layer bonded to a thin cast metal coping that fits the tooth preparation. It combines the strength and accurate fit of a cast restoration with the aesthetic effect of ceramic crown. And in this case, the less tooth preparation required compared to all ceramic crowns is present. Here we can see some metal ceramic crowns. With respect to porcelain jacket crown, it consists of a crown entirely made up of ceramic. They provide the superior aesthetics and excellent translucency. It has good tissue response, even with subgingival localization. It has reduced strength and is the least conservative of all of the tooth preparation. Here we can see porcelain jacket crown. Full cast metal crown is a full crown restoration which is cast with dental alloy. It had high strength, is long-lasting and requires the least amount of tooth preparation, but it's not aesthetic, and so it shouldn't be used in areas where aesthetic this is like prime of concern. With respect to per-shell cast metal crowns, they could be used when the buccal surface of the tooth is intact, and generally they are more conservative of tooth tissue than complete crowns, but they are more demanding technically for clinician and for the laboratory. For example, here we can see some example of per-shell cast metal crown. Temporary crowns, these are also some like part of the prosthetics that is made to protect a tooth that has been prepared for a permanent crown, while the patient waits for this permanent crown reconstruction to be fabricated in the dental laboratory. They could be polycarbonate, acrylic temporary, custom case temporaries, or composite resin temporary crown. Here we can see some example. So, conclusion of these topics. If we have anterior teeth, class 1 up to 3, it means that we have 2 or 4 up to 4 walls. Complete coverage is not required, and so conservative treatment using resin composite will be realized. If you have class 4, in this case, complete coverage is required and prefabricated fiber post with composite core and full ceramic crown should be made. If you have larger defect, class 5 without walls, complete cover is required and prefabricated fiber post with composite core, full ceramic crown should be realized. In the case of posterior teeth, if we have class 1 up to 3, so in this case also this is the individual according to the thickness of hard dental tissues and according to the quality of these remaining walls, we can use conservative treatment on onlay, but as I said, all of the premolars with endodontic treatment should be covered by like some overlay crown maybe. With respect to molars, if this is a major occlusal cavity, narrow cavity, we can make direct reconstruction, but really carefully. Class 4 and class 5, where we have larger defect, we should make in the class 4 where we have just 4 with just one wall remaining, it's necessary to make the composite core, fiber post and metal ceramic crown. In the case of class 5, where we don't have walls, prefabricated fiber post is used, composite core and metal ceramic crown. But also once more remember that post-endodontic reconstruction, this is a really complicated, difficult, and this is a really individualized decision in each concrete patients. Thank you very much for your attention and have a nice rest of the day.